Now, to grace the stage with his presence, I would like to invite our next speaker to talk on the topic National Program for Prevention and Management of Trauma and Burn Injuries. Ladies and gentlemen, please join me in welcoming Dr. Rajiv Kumar Jain, ex-core group member for guidelines on medical preparedness and mass casualty management of the National Disaster Management Authority. Let's welcome him, everybody.
How many of you are nurses or nursing students in this hall? Kindly raise your hands. Okay. How many are doctors or medical students in this hall? Doctors and all right. So this is a absolutely perfect combination. Doctors and nurses together. Unless it is multi-stakeholder, emergencies cannot be managed. That's point one. Second, how many of you are Indian citizens? How many of you are Indian citizens? Kindly raise your hands. Yes, how many of you are proud of being an Indian citizen? Raise your hands. Right, great. Now, do you know in this country of which you are a citizen, the Constitution of India gives responsibility of disaster management to which government? The state government or the central government? Anybody who knows the answer, kindly raise your hands. Who is responsible for disaster management as per the Constitution of India? Kindly say whoever thinks it is the Union of India, the central government, headed by the Prime Minister. Kindly raise your hands. Kindly raise your hands. How many of you think that state government are responsible for managing disaster management? Kindly raise your hands. Absolutely. Now, this is the reason that we have this as the last session. This is the reason. Disaster management is the responsibility of the Union of India, the central government. Why? Anybody can answer. Any of the nursing students, do you know why it is with the central government? Do you know why it is with central government? No. On 26th January, could I have the next slide? Oh yes. On 26th January 2001, everybody was waiting for the Republic Day parade. But what happened? What happened? What happened? Young students, 2001, were you born there at that time? Any of you were born at that time? Any of the nursing students? None of you may have been born. But exactly when the President of India was waiting, earthquake happened. Where did it happen? Where did it happen? Bhuj. How many people got killed? How many people lost their lives? How many cities got totally destroyed in Gujarat? Just when the entire population of the country was waiting to watch the Republic Day parade. 9:48 a.m. All houses razed. All markets, everything razed. Are you aware of that? The estimate at that time by international agencies was 1,25,000 people lost their lives. And suffix is only, because we do not know. And at that time, there was no law in the country. There was no agency in the country. There was no act passed by the Parliament of India for managing disasters. Are you not surprised? In 2001, Indian Parliament had not passed an act for managing disaster management. Are you aware of this? This is a paradox of our country. And our constitution in our parliament. It was in 2005 that the National Disaster Management Act was passed by parliament. Am I with you? And I'm happy to see the silence. This silence will give you the motivation to understand why this 4th Global Summit on GEMS is happening. Now, Disaster Management Act by Parliament created a new body known as National Disaster Management Authority. National Disaster Management Authority, NDMA. It's a statutory body, it's a regulatory body which has the responsibility to lay down all the guidelines and that have to be followed by all the citizens of the country by law. You cannot say that I am owning a hospital, I am owning a shop, I am owning ambulance, everything can be taken over by the Government of India. As per the law, if you read NDMA Act, it empowers the Union of India to take over any asset of this country situated in the Union of India. Are you aware of this? All your nursing colleges, all schools, all residences can be taken over by the Government of India by this Act of Parliament of India. But it does not stop there. It also created the State Disaster Management Authority, SDMA. It also created District Disaster Management Authority. Can you imagine it happened in 2005? After 4 years of Gujarat disaster or 1984 Bhopal disaster. Now, December 2005, this act and the authority was created. In 2007 October, we had the national guidelines for disaster management and mass casualty management, medical preparedness and mass casualty management. Are you aware of these guidelines? Anyone in the audience? The NDMA put out to the Indian population, Indian citizens, national guidelines for medical preparedness and mass casualty management. How many of you are aware of these guidelines? Kindly raise your hands. How many of you have seen this document? Medical preparedness and mass casualty management by National Disaster Management Authority. It was in October 2007. I happened to be lucky to be part of the national core group which had prepared these guidelines over a period of 1.5 years, and it was given to the Union of India and all state governments, all ministries. This document is a statutory document. All state governments, all the union government, all the district administration are supposed to implement this. Are you aware of this? Now, this document lays down that the ministries and the state governments shall implement these guidelines. Yesterday, somebody was, Red Health is sponsoring this. He was not aware that there is a document through which all the population, all the governments have to flow their funds for implementation. Now, this particular document laid down the national program for prevention and management of trauma and burn injuries was started by the Planning Commission and then given responsibility to the Ministry of Health for implementation in the year 2009. And money was also coming forward. And after this, you saw a lot of trauma centers getting built. You saw a lot of burn wards getting built, and a lot of manpower and other infrastructure getting on the ground. Objective was to reduce incidence, mortality, morbidity and disability due to burn injuries, improve awareness among the general masses and vulnerable groups, especially women, children, industrial and hazardous occupational workers. I am These are none of these are my words. This is national doc to establish adequate infrastructure facilities and network for behavior change communication, burn management and rehabilitation intervention, to carry out research for assessing behavioral, social and other determinants of burn injuries in our country for effective need-based program planning for burn injuries monitoring and subsequent evaluation. Prevention, treatment, rehabilitation training and monitoring and research were its components. Dedicated burn care services in 70 medical colleges were started and 25 district hospitals. Availability of skilled manpower and increased awareness regarding prevention of burn injuries was also there. Then trauma care. If you see, this is the global scenario. Also, if you look at the Indian scenario, and this is what started the whole process of funding, manpower, equipment and infrastructure building across the country, which is to be utilized on a common public facility basis. It's not owned by XYZ organization, it's not owned by anybody, it's owned by the citizens of this country, to be utilized by anybody without payment. Remember this, all this is free of cost, created from public funds for public welfare. These happened between 2009 and 2017. Level 1, level 2, level 3 trauma care facilities were created and they are existing today. They have developed much more. The manpower has also developed much more and the whole program has taken a new shape and it's available to our common benefit. Many people have a habit of decrying the government does not do, government does, but it does not project. It's available. All of us will witness how government managed the COVID pandemic. Under what act? Under what act COVID was managed in the country? Anybody? National Disaster Management Act. Who was issuing the orders? It was Ministry of Home Affairs. Why? Because the nodal ministry for implementing National Disaster Management Act is the Ministry of Home Affairs in Government of India. It is not Ministry of Health, not Ministry of Industries, not Ministry of Labour, not Ministry of Defence. It is only Ministry of Home Affairs, which has the power to do anything they like to implement any disaster of whatever kind, including biological disaster, of which COVID-19 was one of them. And you cannot say, I will not follow. You have to follow. That is the reason COVID was managed better. We had a legal framework, we had the empowered district magistrate, the state secretary of home and the central Ministry of Home Affairs. That's why we were able to get over this pandemic during 2020 and 2021. Now, this is beside this. Now we have seen the capacity building, the training which happened. I've just mentioned few achievements, but this is not all. There is much more. This is also the achievements which have happened on the national program for trauma and burn injuries in the country. And I find lack of awareness within our medical practitioners and the nursing practitioners who are not aware that this has happened. This much resources have been created. That's important for all of us to be proud of. That's why India today is proud that we were able to tackle COVID disaster much more effectively than many of the developed countries. Even USA, we managed better. Our outcomes were better. This is also, if you see, World Trauma Day is also determined. Road Safety Week is getting implemented. A lot of other facilities are already created. That's why this GEMS is in continuation of that process, which was started by the Parliament of India in 2005. How many years? 20 years. Next year we'll be celebrating 20 years of this act by Parliament of India. And we are on our journey to celebrate the 100 years of independence of India. Parliament works, people's voice works, our parliamentarians work because they responded to the challenge of Gujarat disaster. And we were able to tackle much bigger challenges over the last 20 years because there was a framework, there was a body, there was no national disaster response force. Now we have at least 16 battalions of NDRF who respond to any disaster. They are the first to reach. They are the first to reach. In Dwarka, there is an NDRF unit. Anything happens in Delhi, they are the first to reach because they have the resources, they have the training, and they have the financial wherewithal. Burn injuries, huge infrastructure for burn management. Earlier, it was only Safdarjung Hospital, which was all the patients were being rushed to Safdarjung Hospital. Entire North India rushed to Safdarjung Hospital because that was the only burn unit of that character and the scale which was available in the country. Now, burn units and the trained manpower is available across the country because somebody thought that this is important. Trauma and burn are linked. You cannot separate the two. So that's why the two programs were merged, and that started rolling out till 2020. This is what 2010. Remember, unless the national guidelines would have been there, this would not have happened because the funding. How do we get the funding? Anybody who knows in the United Nations, which is the body of 194 countries, which UN body is responsible for disaster funding? Anybody in the audience? Anybody can tell me whether WHO, ILO, UNICEF, who funds, who gives the money? Who has the money to give to all the 194 countries in the world? Anybody in the audience who can respond after this 2 days of James conference? Any idea? UNDP. Absolutely. Dr. Sriniket, thanks a lot. UNDP is the only agency which has the funds. It has the decade for disaster risk reduction across the world. Now, UNDP gives the funds. UNDP has already given the funds to India, but India did not know how to spend that money. Now, this money has been spent and is being spent, and we are getting more funds. The more you spend, more money you get. So, this is what has happened. This has also happened during the last 20 years. Now, the last question: who is implementing the national trauma program in the country now? Anybody? Which ministry is implementing national trauma program? Anybody? Dr. Kamla, or NHPC, or Hero Motocorp, or Railways, or GSK, or anybody from the audience? Which ministry is implementing the national trauma program in 2024? Any idea? No. It was given over from the health ministry to another ministry. No. 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 Much more common sense response. Where the trauma occurs in our country, number one. Absolutely right. Common sense. Cabinet of India decided to approach the common sense approach for managing national trauma program. It is the Ministry of Road Transport, Ministry of Mr. Nitin Gadkari. Entire program. Now you have the national highway networks. The trauma centers are following the national highway, and then state governments are implementing the state highway. They have the trauma centers there. The level 1, level 2, level 3, and in addition, the communication network. That 112, somebody mentioned in the morning. 112 is a common number for the country. You don't have to remember multiple numbers. Just dial 112, try once. If you try it from your mobile or landline, it works. It works for the ambulance or any disaster for that matter. It is not medical emergency. It's for any disaster. 112 works. And because of this, remember this, it is not emergency medical services, it is disaster, under which EMS is one small part. And we all as medical professionals and nursing professionals are responsible under the Constitution of India, whether we are working in the private sector or the government sector or any sector, we are responsible and we are duty bound to work to implement this act which has been passed by our parliament, not somebody else's parliament. Thank you so much for this concluding remarks on this last session of this conference. Thank you so much.